Hello everyone, let's see an important topic of oral surgery, masticatory spaces. There are three masticatory spaces, submasseteric space, pterygomandibular space and superior and deep temporal space. Let's see pterygomandibular space. This is the pterygomandibular space and it is bounded anteriorly by the pterygomandibular raphe. It is bounded posteriorly by the parotid. Medially, there is the medial pterygoid muscle. Laterally, there is the medial aspect of the ramus. This is the medial aspect of the ramus. This is the lateral aspect of the ramus, and the pterygomandibular space is bounded laterally by the medial aspect of the ramus. Superiorly, there will be lateral pterygoid muscle, and inferiorly, there will be pterygomasseteric sling at the junction of the medial pterygoid and masseter. The contents of the space are inferior alveolar nerve and vessels and lingual nerve. The etiology for the space infection can be mesioangular or horizontally impacted third molar, contaminated IAN block syringe, or from the submandibular space the infection can spread. The clinical features can be, first of all, there will be no no external swelling. There can be trismus, there will be an anterior bulge on the soft palate and the anterior tonsillar pillar. There will be deviation of uvula to the unaffected site. And there will be difficulty in swallowing. So the spread can be, the infection can spread to the infratemporal space or the lateral pharyngeal space or the retropharyngeal space. Management. First of all, antibiotics will be given. Second, we have to do incision and drainage. For this, Hilton's method is done. That is, through the incision, we will insert a hemostat and then we will dissect blindly and break all the loculi. This is done to release the pressure. So in this case, we will give an intraoral incision, the vertical incision between the pterygomandibular raphe and the median aspect of the ramus. This was the pterygomandibular space. Now let's see submasseteric space. So now this is the submasseteric space. So anteriorly there is anterior border of masseter and posteriorly there will be parotid gland. This is the parotid gland. Medially, that is on the medial aspect, there will be lateral surface of the ramus. This is the lateral surface of the mandibular ramus and this will be present on the medial side of the submasseteric space. Laterally, there is masseter, superiorly zygomatic arch and inferiorly pterygomasseteric sling. So the etiology for this space infection can be pericoronitis or linguoversion of the third molar. The clinical features can be trismus, deep-seated throbbing pain and tenderness over mandibular ramus, swelling over the angle of mandible, which is less common. So management will be done first of all by antibiotics, analgesics, as there will be deep throbbing pain and hydration. Then we will do incision and drainage. In this also, Hilton's method will be followed. So either intraoral incision can be given or extraorally. So extraorally below the angle of mandible. And intraorally, the anterior border of mandible till the buccal vestibule. So incision is given on the anterior border of mandible till the buccal vestibule till we reach the swelling area. So this was masticatory spaces part 1. If you found this video helpful, please like and subscribe. Thank you.